Hello everyone, welcome to this audio podcast sort of overview in around this in around you know, the in around this radio edition. This audio podcast will provide will provide a sort of a synopsis, an overall synopsis around the around the radio in and around the radio edition, where there have been there have been sort of intros different art book into several different several art books that will be in process and in production. And in this audio podcast, as part of this radio edition, the synopsis will be as thus. So there is a sort of a sort of a prompt surrounding the importance of quality of joined up sort of aspects of healthcare in meeting sort of educational needs, and sort of in aligned to and sort of allied to point of care education, or POCE, and addressing healthcare inequalities wherever possible. And so, at the same time, there is still work to be carried out, wherein service users and service providers sort of co-develop efforts. And service users, for example, still often require sort of advice or sort of guidance on how to on how to sort of how to sort of how to sort of grapple grapple with aspects of disease and with different different aspects around disease and at the same time, sort of where sort of peer to peer interactions can be used to educate and empower service users, and also service providers. Alone peer support, again, is inadequate, or has been evidenced as as inadequate, and can be imperfect. Often service users, for example, are not always prepared in around diagnoses of diseases, different classification of disease processes, and disease and in around disease severities. So access to sort of access to allied health professional, or AHPs, at the same time through online space aligned to point of care education, would also would also support service users, or could also support service users surrounding quality and evidence-based practices. Educational services would be helpful, and provide service users and providers opportunities between healthcare sectors. And the role of the role of the role of sort of online online consultations, and in around online consultations, but also in around sort of as where service users and service providers are using and approaching sort of social media platforms, or online groups, could 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 be could be and should be based under the realm of under the basis of health promotion in context of public health. And this is an important focus across patient care across patient care, and having access to AHPs or allied health professionals prompts service users, particularly to be more included in aspects of healthcare, including aspects of healthcare, and thus increasing practical understanding of disease treatments, and overcoming hindrances between healthcare aspects and around healthcare and between healthcare sectors. So there have been at the same time there have been investigations that have been in the literature to inform that the importance of health literacy in context of reflection and action for aspects around health. And non-adherence, for example, is also attributed to poor health and misinformation, and is one of the reasons that sort of coexist for one of the main bases why for example poor healthcare exists or coexists, and so at the same time the art books sort of look to prompt some reflective bases as well. But at the same time, the in around this sort of synopsis, generally service users and service providers at the same time where in literature there's works that have delved into what's been referred to as patient and public involvement, or PPI, in aspects of health promotion and public health, but also at the same time to heighten the importance on where service providers should seek to comprehend. Service providers should seek to comprehend the essence of clinical science, laboratory practices, clinical epidemiology, epigenetics, patient-led initiatives, and healthcare inequities to place them more as sort of holistic healthcare professionals accordingly, and having an overall understanding of what where to bridge gaps in healthcare should also allow multidisciplinary teams, for example, to better comprehend translational science, especially in bettering regimes in around some of the sort of main themes that are within across the art books themselves. So, for example, in around transplantation, I'm looking at sort of aspects around polypharmacies, aspects around for example, investigations, testing investigations, and also having an appreciation of patient-led initiatives, all being pertinent. Prospectively, and sort of in line to this radio edition again. Service users should envisage service providers or health professionals in online educational clinics, or something that has been, or wherein some works that has been in some works in context of educational clinics, or e-clinics, for example, to help integrate healthcare and lived experiences. It would be helpful to conduct. It would be helpful, sort of prospectively, um, to see that there's to see that to see that sort of specific aspects of investigations are sort of are propagated in line to sort of mentoring and the interplay of healthcare service users between social media platforms, and additionally or prospectively, works should also seek to explore and understand if and whether again it is advantageous to involve AHPs, allied health professionals, in online consultations and or educational clinics, to improve to improve aspects around the lives of service users who are suffering with particular conditions, and as part of routine aspects of care. And additionally, research prospectively should seek to, number one, inform works in around looking at coping strategies that service users may utilize, and number two, to highlight the sort of challenges in around particular in around particular disease aspects of disease, and also where some of those pertinent aspects are important between, for example, pediatric and young people services, and adult healthcare services as well. And number three, really to outline how services for service users could be better. So that draws this synopsis to a close in around this radio edition, where the synopsis looks to provide an overview in context of the art books as a sort of an underpinning sort of perspective in around the art books as part of a radio edition synopses. So thank you for tuning in. And this has been an audio podcast as part of a Storm Robotics production and a Storm Robotics collaborative, and an audio podcast as part of a research and analysis. Thank you.